Hi, my name is Dr. Anthony Nici and I am a gastroenterologist at Crystal Run Healthcare. Today I'm going to be talking about the bowel preparation requirements that are needed to be done before you have a colonoscopy exam. The colonoscopy procedure itself is a flexible endoscope examination where the doctor will insert the camera scope via the rectum into the large intestine and pass it all the way up to where it meets the small intestine in order to help diagnose if any polyps or cancers are present and to work up any other potential bowel pathology that had been occurring. The bowel preparation is an important aspect of the colonoscopy exam because if you are not cleaned out appropriately, it is very hard for the doctors to find certain polyps and potentially missed lesions. So the day before the examination, you're going to need to go to your local pharmacy and purchase a bottle of Miralax powder. This is a 238-gram bottle of Miralax. You also are going to need to purchase a small box of Dulcolax tablets. These are 5 milligram tablets that are stimulating laxative pills. And you should also purchase a type of clear liquid that you're going to want to mix the Miralax into. That could consist of white grape juice or apple juice, Propel water, Gatorade, iced tea, or just plain water. You should refrigerate the liquid that you choose that you're going to be using because it tastes better when you're actually doing the preparation. 2 days before the exam, you should make an effort to try to avoid having any nuts or seeds or popcorn, and also avoiding any fruits or vegetables. The day before the exam, you will need to be on a completely clear liquid diet the entire day for breakfast, lunch, and dinner. That clear liquid diet will consist of chicken or vegetable broths, strained fruit juices, coffees, teas, sodas, ice pops, and Jell-O. You should try to avoid having any dairy products the day before the exam, but it is okay if you want to mix some milk into a cup of coffee or a cup of tea, and you should try to make sure that you don't drink any liquids that have any red food dyes in it, such as a Jell-O or red Gatorade. So at 12 p.m. the day before the exam, you're going to actually take the Dulcolax tablets. You can take 2 of these with a full glass of water, and that's going to help stimulate your bowels and get you ready for the actual liquid component of the exam, of the procedure. At 3 p.m. you're going to actually take a bottle of Miralax and you're going to mix the entire contents into 64 ounces of any of the clear liquids that you chose. Make sure that it's fully dissolved, and then you're going to start drinking a glass of 8 ounces of the liquid every 15 to 20 minutes until you're completed. At 6 p.m. you're going to take 2 more tablets of the Dulcolax with a full glass of water, and that's going to end the medication portion of the bowel prep. For the rest of the day, you're going to stay on a clear liquid diet until midnight, and then nothing to eat or drink by mouth after midnight the night before. If your procedure is scheduled for after 10 a.m. the next day, then your doctor may instruct you to drink half of the Miralax prep, which is 32 ounces, the day before the exam at around 6 p.m. And then at 9 p.m. they would want you to take all 4 of the Dulcolax tablets at once. The next day, in the morning, about 4 hours prior to your procedure, you would then drink the rest of the Miralax preparation, the final 32 ounces. You can take all of your blood pressure medications and cardiac medications with a sip of water the morning of the exam, unless you are otherwise instructed to by your provider. You should avoid taking any aspirins or Motrins or Advils, Aleve, ibuprofen for about 5 to 7 days before the exam, and you should also avoid taking in any vitamin E for 5 to 7 days before. It is okay to take Tylenol before the procedure. Some helpful tips for the bowel preparation include consider drinking the prep using a straw, purchasing baby wipes or Tux pads instead of using toilet paper when wiping, and to try not to stray too far from the bathroom when you're prepping. Please notify your doctor if you are a diabetic, have an underlying seizure disorder, take any blood thinners, have a latex allergy, or if you have a pacemaker or cardiac defibrillator implanted. You will be having anesthesia the day of the procedure, so you will not be able to drive home that day yourself. You do need someone else with you that can take you home. If you're going to be taking a taxi cab, you will need someone else in the taxi cab with you besides the driver. If you have any further questions after reviewing this video, please reach out to our office staff or your doctor, and we can help you answer any further questions that you may have. Thank you.